Welcome back, guys. Welcome back to a final quiz on patho. So today we'll be completing pathology, and we'll have 20 questions as usual. Each question will get 35 seconds, and there'll be no negative marking, so you can attempt all the questions. Okay, we'll start the quiz at 10:10. Two more minutes, we'll start the quiz soon. Okay, guys, it's time. So, welcome back to today's JuxtaMed quiz. Get ready for some high-yield patho questions today. I'll give you the clues. You should connect the dot, okay? So, let's begin. A 35-year-old female presents with pallor and fatigue. Lab tests show low hemoglobin, low MCV, low serum iron, low ferritin, but increased TIBC. What is the most likely diagnosis? A very easy start. A clear-cut question, I guess. You don't require any clue for this. Yeah, it is iron deficiency anemia. Okay, we have PKSM in the first place, followed by Shanmugapriyan and the Leo, followed by Panda L. Okay, let's move on to the second one. A 60-year-old male presents with progressive weakness, hepatosplenomegaly, bone marrow aspirate is dry tap, and BRAF mutation is present, and TRAP stain is positive. What is the most likely diagnosis? So, to give a hint, think of a small hairy detail that makes these cell unique under the microscope. I think you got the answer. Yeah, right. It's hairy cell leukemia. Okay. Okay, we have Krishna now, who is leading, followed by Panda, Soumyashri, RDT, and Shanmugapriyan. Okay, guys, let's move on to the third question. Young male presents with painless cervical lymphadenopathy. A lymph node biopsy shows reached network cells. Which of the following is most likely diagnosis? This too is a classic and easy question. So uh, this can be a type of image-based question we get. And the question they might give it as a clinical one. Okay. And this is a type of lymphoma which is often linked to Epstein-Barr virus and follows a bimodal age distribution. Right. It's Hodgkin's lymphoma. Okay, we have Panda leading now, followed by Krishna, Shanmugapriyan, Soumyashri, RDT, and PKSN. Okay. The 60-year-old male presents with back pain and fatigue. Lab results show hypercalcemia, anemia, and renal dysfunction. Serum protein electrophoresis shows an M spike. Which of the following is most likely diagnosis? Yeah, the right answer is multiple myeloma. Is it okay? Yeah, right. Okay, let's see the leaderboard. Okay, we have Panda followed by PKSM, Krishna, Shanmugapriyan, and let's move on to the fifth one. 50-year-old patient with a history of chronic smoking presents with persistent cough and hemoptysis. Histological exam of a bronchial epithelium reveals the replacement of pseudo-stratified columnar epithelium with stratified squamous epithelium. This process is an example of. Again, one more easy question. So this is a reversible adaptation, but if the stress continues, it may lead to malignancy. Yeah, It is metaplasia. Can you also tell any other example for metaplasia, which is often used? Okay, let's see the leaderboard. Not much changes. I think Panda we have in the first place, Krishna in the second place, and PKSM taking the third place. Okay, let's move on to the sixth one. 35-year-old woman develops a keloid following an ear piercing. Which of the following factors is responsible for the excessive collagen deposition? So here, this growth factor plays a major role in wound healing, but sometimes goes overboard and leading to fibrosis. Yeah, it is TGF beta. Okay, we have Panda, Krishna, Karti, Vanji, Ram, and Purkanda Singham, Ashish, Gogo, Suji, and yes. Okay, guys, let's see the seventh one. 60-year-old man with chronic ischemic heart disease undergoes an autopsy. Histology of heart shows nuclear shrinkage, fragmentation, and eosinophilic cytoplasm in cardiomyocytes. What is the most likely process occurring here? So this type of cell death is energy dependent and follows a program. Okay, I guess there's a confusion, I guess. Yeah, this is a coagulative necrosis, okay? Okay, we have Panda, Krishna, Karthi, Vanji. Not much changes. Let's move on to the next one. 40-year-old woman with rheumatoid arthritis develops generalized edema. Lab results show nephrotic range proteinuria and normal serum complement levels. Renal biopsy shows fibrinoid necrosis and immune complex deposition in small blood vessels. So the likely mechanism of injury here is, so this is a classic example of hypersensitivity, okay, which involves the immune complex, to be more specific. Yeah, it is type 3 hypersensitivity. Okay, we have Panda, who is leading the quiz, followed by Vanji, Potkanda Singham, Karthi, Ram, Suji, RS, Krishna, Shanmuga Priyan, and yes. A 50-year-old male develops abdominal mass. Biopsy showed tumor cell with high nuclear to cytoplasmic ratio, prominent nucleoli, and increased mitotic figures. So the following is the most important factor for assessing the prognosis. So the size and spread matter, but what determines the long-term survival in most of the cancers? It is lymph node involvement, okay? Okay, we have Panda, Suji, Vanji, we have Murkanda, Singham, Karti, Ashish, Ram, S, RDT, and RS. Okay, here's your 10th one. 5-year-old child presents with severe pallor, hepatosplenomegaly, and growth retardation. Peripheral smear shows microcytic hypochromic anemia with target cell, and hemoglobin electrophoresis reveals increased HbF and HbA2. What is the most likely diagnosis? So this is a genetic disorder which is more common in Mediterranean and South Asian population, okay? And this results in defective globin chain production. Yeah, it's beta thalassemia major. Okay, we have RDT who has the longest rate, and in the first place we have Panda, Vanji, and Karthi. A 5-year-old boy presents with recurrent spontaneous bleeding into joints and easy bruising. And his maternal uncle had a similar condition. Laboratory tests reveal prolonged APTT, normal PT, and normal platelet count. What is the most likely diagnosis? So this is a X-linked disorder which involves the clotting factor deficiency. Okay, just one step before the factor 9 in the cascade. It is hemophilia A or factor 8 deficiency. Yeah. In von Willebrand disease, the I think the bleeding time will be normal. Okay. Okay, not much changes. We have Panda who is leading. In the second place, we have Vanchi. Third place, we have Hemant. Let's move on to the 12th one. 32-year-old woman presents with severe bleeding from venipuncture sites, thrombocytopenia, and prolonged PT and APTT following a placental abruption. Which of the following best explains the underlying pathology here? So you have to make a diagnosis and then later choose the correct pathology. So one clue is there is severe bleeding, okay? And prolonged PT and APTT. And also platelets are very less. Yeah, the right answer is widespread activation of coagulation. So the diagnosis is DIC, okay? Disseminated intravascular coagulation, which is nothing but a consumption coagulopathy. Okay, we have Banji in the first place and Ram in the second place, Shanmugapriyan in the third place, okay? And we have Dr. Shivarthi, who has the longest streak. Okay, here's your next one. 23-year-old woman with recurrent oral ulcer, genital ulcer, and uveitis is diagnosed with Weichert disease. Which of the following HLA marker is strongly associated? I think I should have removed the diagnosis here. Okay, think HLA markers are important, guys. I think they might ask indirectly also, sometimes directly giving these type of question. So that's yeah, it is HLA B51. Okay. Okay, let's see the leaderboard. Okay, we have Ram who is leading now, followed by Shanmuga Priyan, Panda, Vanji, Krishna, Coco, L. Itachi, Porkani Singham, PKSM, S. Ashish, Hemant, Aisha, Suchi, RDT, Kavita, Soumyashri, Haris, Karthi, Raksha. Okay, guys, good going. Let's move on to the 14th one. Which of the following stain is most commonly used to confirm amyloidosis histologically? So again, one more easy question. So here under polarized light, this stain gives a classic apple green birefringence, okay? Yeah, the right answer is Congo red stain. Okay, if we have Panda back in the first place, then we have Krishna, Vanji, Gogo, and L. Okay, let's move on to 15th question. Acute promyelocytic leukemia is associated with which of the following chromosomal translocation? So here, this translocation involves a fusion between a retinoic acid receptor gene and a gene on chromosome number 15. So can any one of you tell what is the treatment which is used here in this condition? Yeah, the right answer is translocation 15, chromosome number 15 and 17, that is PML, RARA, okay? Okay, not much changes. We'll go to next question. Elderly male with history of hypertension, Marfan syndrome, presents with sudden severe chest pain, radiating to back. BP is 180 by 110. CT aortogram shows a dissection starting in the ascending aorta, extending to descending aorta. Okay. According to the D-Becky classification, what is the type of dissection? So this type of dissection involves both ascending and descending. Okay. Think of the most severe category. Yeah, the right answer is type 1. Okay, we have Vanji who is leading now, followed by Panda, Krishna, yes, and PKSM. Okay. Okay, we have Sweetie1994 giving us the answer in YouTube live comments. Let's move on to the 17th one. 28-year-old female with systemic, that is SLE, presents with fatigue and dyspnea. Echocardiography reveals small sterile vegetation on both sides of mitral valve. What is the most likely diagnosis? So the vegetation is sterile here and also on both sides, okay? Yeah, it is Liebman-Sachs endocarditis. Okay, not much changes. We'll move on to the next one. 58-year-old mine worker presents with progressive dyspnea and chronic cough. He has worked in underground coal mines. Okay, again, I should have removed coal here. So I think the histopath is given, histopath image is given. What will be your diagnosis? So seeing the image, I think we can get the right answer easily. Okay, it is anthracotic particles over seen over there. Yeah, it is coal worker pneumoconiasis. Okay, we have Vanji in the first place, followed by Panda, Krishna, yes, Taji. Let's see the last second question. 30-year-old male presents with recurrent episodes of painless hematuria. Kidney biopsy is performed and shows mesangial proliferation with IgA deposits on immunofluorescence. What is the probable diagnosis? So here one classic clue is mesangial proliferation. I think that will easily you can get the answer from that point itself. And this is also a most common cause of glomerulonephritis worldwide and often follows an upper respiratory tract infection. Yeah, it's IgA nephropathy. Okay, we have a close competition between Manji, Panda. Okay, let's see who wins the quiz today. Going to the last question. 28-year-old male presents with fatigue, jaundice, and dark-colored urine for past 3 days. His serology results are HbsAg positive, anti-HbC IgM which is positive, and anti-HbS is negative. What is the most likely diagnosis? So let's see who gets this right. How many of you get this right? Yeah, it is acute hepatitis B, okay? Because the antigen is still positive, and we have IgM antibodies which are produced, okay? And we have uh, antibody against the HPS is still negative. So it is classically an active infection state, okay? Okay, we have Vanji as the winner today. Congratulations, Vanji. And barely, I think, some 6 points. That's all. Okay, good going, guys. Good going. And we have Panda as the second winner of the quiz today, and S as the third winner. Congratulations, guys. We have Itachi, Ram, Rakshaya, Vasudevan, then Krishna, PKSML, and Gogo. Okay, congratulations, guys. So we have successfully finished pathology, and I think from tomorrow we'll have Dermat. So Dermat will go on for 3 days. So I think sir will send you the schedule on the Telegram group. So we'll see how it goes. And yes, guys. So finally, patho is done. One of the very important subject. And okay, guys. So that's a wrap. Hope you enjoyed today's questions. And until next time, keep diagnosing, keep learning, and stay sharp. Okay. We'll I'll meet you on the next quiz. Okay. Good night, guys.